So the topic I chose was ACL tears. I chose this because a lot of my childhood best friends have torn their ACLs multiple times, and a really close friend of mine actually tore his last week. So I just wanted to know the difference between operative treatments and non-operative treatments, and if a patellar tendon graft is better than a hamstring graft, and if one has lower failure rates than the other. Background for ACL tears are ACL tears happen when contact or no contact pivoting happens. So in the picture, he's obviously getting hit and pivoting and tore his ACL. Females are more likely to tear ACLs than males. Females tear their ACL on their supporting leg, while males tear their ACL kicking on their kicking leg. The peak years for ACL tears are during high school. The epidemiology for an ACL tear is patients who are post-surgery only have a 2% readmission rate, while if you have surgery on either knee in a year, it's about 6% readmission. You're at higher risk for readmission and an ACL tear if you're over 40 and you're sick or you're male. Identifying an ACL tear. Well, as an athletic trainer, we use special tests like the anterior drawer. We are looking for pain and laxity and to see if the tibia anteriorly translates. If you're, obviously, you go send them to the hospital and they will get an MRI to look at the ligaments to see if it's completely torn, partially torn, or what. They also take x-rays to rule out any fractures. Operative. One way of treatment is to operate on the ACL and reconstruct it. I'm looking at patella tendon graft versus a hamstring graft. A patella tendon graft, a surgeon takes about 1/3 of the patella and reconstructs the ACL. The graft is secured down with screws on the femur and the patella. And a hamstring graft, surgeons take about 4 strands from the hamstring and they use it to reconstruct the ACL. And studies have shown that the hamstring graft have a higher failure rate than the patellar tendon graft. For non-operative, the patient or athlete will have to go to physical therapy a lot to try to re-strengthen the knee and hope that it doesn't tear more. And they would have to do a lot of lifestyle changes and make sure that they don't do a lot of pivoting and jumping and whatnot. And here's my reference.